Now we turn to medical rounds. The month of May is Mental Health Awareness Month, and it's a topic that often leaves people feeling labeled and stigmatized. Pat Reamer is Senior Vice President of Hartford Healthcare, and she's joining us live now to talk about the ways that Hartford Healthcare is improving access to mental health care. Good evening, and thanks for joining us tonight, Pat.
Thank you.
Well, we often hear about the stigma surrounding mental illness, but you refer to it differently. How would you describe mental illness?
Well, I think it's important for people to understand that mental illness or substance use disorders are disorders of the brain, like any other medical condition. And they are, if you have a diagnosis, it's a part of who you are. It shouldn't define who you are. So if you have cancer, for example, you can also be a mother, a sister, a hospital administrator. And there are many, many different facets, and we need to begin to think about individuals with behavioral health disorders in the exact same way.
Well, because many people perceive it still as a stigma, and because sometimes there's discrimination that comes with that, how do you get patients to come forward and get the care that they deserve? How do you get around that whole fear?
Well, I think it's important to differentiate stigma and discrimination. So stigma is really more about how the individual feels about themselves. Often they're ashamed, they're afraid people will find out. Discrimination is how we treat people with behavioral health disorders, whether it's not giving them jobs, not giving them access to housing. There's a myriad of ways that individuals with behavioral health disorders can be discriminated against, and it does impact access to care.
Well, what is Hartford Healthcare doing to improve access to mental health care?
So we have just started actually putting psychiatric clinicians, often social workers, in our primary care offices, and there's a psychiatrist who backs that individual up. And so if a primary care physician sees something when they're meeting with a client, there is a clinician right down the hallway that individual can see. And it's very, very helpful to be able to do that right on the spot in the office when the primary care physician may be seeing something, and the social worker can evaluate that, and then the psychiatrist can consult as needed.
Good to know. We thank you so much, Pat, for sharing your insight with us tonight.